Hey guys, Chris Lewandowski, Princess Center Dentistry. It's Monday afternoon. I'm going to talk to you briefly about dental implants, or the difference between dental implants and a dental bridge. Again, Chris Lewandowski, Princess Center Dentistry, Scottsdale, Arizona. So if you're watching this video and you have an interest in how to replace a tooth, then you've obviously ended up in a situation where you've got a missing tooth. That can happen for various reasons. Trauma, you could have some dental work that's gone bad, maybe a cracked tooth or a root canal that didn't work, and now you've got a hole in your mouth and you're interested in replacing it. There's a couple options, or basically three options. One, you can do nothing, which we don't recommend. If you don't replace a tooth, your other teeth may shift. It can result in some bite problems or some tilting of the neighboring teeth. And then you can get into some occlusal trauma, or you can develop TMJ or other issues. It's much easier to go ahead and replace the tooth just to maintain stability and avoid all those problems. So to replace the tooth, there's two ways to do it. You can either do a dental implant or a dental bridge. I have a model here, so this is an implant model. The implant itself is placed by an oral surgeon or a periodontist, basically a titanium post that goes into the bone. On top of that implant is what we call an abutment or an anchor, and on top of the anchor we do a crown. So again, the implant is placed by an oral surgeon or periodontist. The abutment and the crown that go on top is placed by a general or cosmetic dentist like myself. The disadvantage of an implant is that it involves a surgical procedure, placing the implant itself. If surgery isn't your thing, then a dental implant may not be for you. Once the implant's placed, putting the tooth on top is actually very easy. In fact, we don't need to numb you or anything. It's just a matter of titanium parts. So the real challenge there is just getting the implant and getting that set. Start to finish, that could take 3 months, so be prepared for a bit of a wait. If you're not going to do an implant, then another way to do this would be to do a bridge. And for a dental bridge, you're going to be using the neighboring teeth. And I'm just going to take this abutment out and show you a different look at this model. So this would be in your mouth. If you have two teeth missing and the middle tooth is missing, we can use those neighboring teeth as anchors and put a 3-unit dental bridge into that spot. To do that, we have to take 1 millimeter off the sides and the top of the two surrounding teeth. And then we would be taking this piece here and cementing that in or gluing it in, and you've got your missing tooth. The disadvantage of a bridge is you can't floss in between there. The advantage is it's very quick and easy to do. In fact, I can do that in less than 1 hour. There's no surgery. The success rate of bridges is above 99%. So both of these options are viable, and both of them will replace your teeth or tooth. And for the most part, your friends and family won't be able to tell which option you've gone for. They both look identical in your mouth. One of the main advantages of an implant is that you don't have to use the neighbors as an anchor, and you can floss with an implant. But there's other factors, including the density of the bone, the position of the gum tissues, and even the way your teeth come together or your bite, as well as where the tooth is in the mouth. So if you'd like more information on these two dental options, you can of course come in and see us. We'll be happy to give you a free consultation at any time, and we can take a look in your mouth and decide which option might be best for you. I hope you've enjoyed this, and maybe you've learned something about dental implants versus dental bridges. Again, Chris Lewandowski, Princess Center Dentistry from Scottsdale, Arizona. Enjoy your Monday.